What is e-prescribing and how does it work? And why should you care? This is another video in the series on The Doctor is In. It's getting you access to great health care in your home while you're waiting for coronavirus to blow through. This one's on e-prescribing. What is e-prescribing and how does it work? And why should you care? Well, very simply, what e-prescribing is, this is something that we've developed over a decade ago. It's a way to get the prescription from the doctor to the patient in an electronic format. So it's electronic prescribing. That's what e-prescribing means. Now, why did we need that before the age of telemedicine? Because of quality. Did you know that the #1 cause of physician prescription error, of any kind of prescription error, is physician handwriting? People laugh about doctors and their awful handwriting. I am a doc. I do have awful handwriting. But here's one of the major dangers associated with that. It's not just a laughing matter. Countless errors have occurred in e-prescribing because of bad handwriting. So this was set up a long time ago. Now let me go back and show you how our e-prescribing system works. Maybe that will help a little bit. First of all, let's get our tab up, go over to Practice Fusion, log in, and I will walk us through e-prescribing on my chart for metformin. I already have a metformin prescription, but I'll just show you how it works. Go down to medications. So again, Thomas Ford Brewer, flow sheets, diagnoses, allergies, etc. We already have metformin, but let's say we want to add one. When I see a patient, I will document it in the notes section of the chart. Then that will go to Michelle and Laura-Lynn, our nurse, and they will transcribe the e-prescription. So the way they do this, and the way I can do it when I do the e-prescription transcription as well, is you go in, you click on that, you say medication. We'd like to try metformin. Here's metformin powder. Here's, you see it has a word finding component to it. Okay, metformin powder, 500 milligrams oral tablet. Click on that. Then it gives you some options. It says you may have therapeutic duplications. Now, why is it saying that? That's another safety component geared into the software. It's saying, look, you're already on metformin 500 milligrams oral tablet by mouth twice per day with meals. So they're saying, look, it would be a severe interaction if I took that. So let's go back again, just for sake of showing you how this works. We'll hit discontinue. And now we'll say, okay, I want to use metformin, prescribe metformin 500 milligrams. No, I don't want the metformin hydrochloride powder. I want metformin 500 milligrams. There we go. So alert, SIG. SIG means the sign, the instructions on there. So they pop up different options. This is the most common option. Take one tablet, 500 by mouth, 2 times per day. So I click on that and that auto populates. Dispense, 90 days worth. Associated diagnosis, start date today. No comments. And then as you see here, we'll click record. Medication recorded. And then we are done. Now there's some other complications to it. There's some other details that we have to fill out. But this was just a quick overview to help you understand how e-prescribing works. Thank you very much for your interest. There's nothing like a community. We saw that in the Louisville event. People got together and started talking about how they've had challenges and successes in preventing their own heart attack, stroke, or chronic disease. it became very clear that you don't have to be a doc with a full-time 30-year career in preventive medicine to understand this and successfully prevent heart attack, stroke, the number one killer and disablers of people. You don't have to be a physician to prevent eye disease, kidney disease. All you have to do is think, listen, and become part of the community. Now, how do you do that? Go to the membership login on our webpage, and as you can see, you can get right in. You have to sign up if you haven't signed up already. And I've already signed up. I've already gone in. It's very simple, very easy to understand. In order to help encourage this, after the success and the positive emotion, the positive impact that we're seeing with these events, we're saying, look, we need to offer more of these services for free in order to help grow this community. So you'll see us starting to do drawings for the webinar event, the courses. We've got a book coming out in about a month. We'll be offering that. Even full-blown evaluations, providing those for free for folks that, again, help us grow the community. So if you'd like to find out what the most recent rules are for the most recent drawing, just come to the membership page. Thank you for your interest.